Hello and welcome to the Alabama Public Health Training Network. Thank you for joining us today for our program, What to Know About Protecting Yourself and Others from Disease, a General Communication Disease Overview. The objectives today are define the Detect, Test, and Report campaign, identify reportable conditions, who should report, time frames to report, and ways to report. Identify the most accurate diagnosis, testing, treatment, and reporting of notifiable diseases. Describe how to locate basic disease information. Describe general communicable diseases and the ways to prevent infection. And verbalize where to find the tools and information available regarding disease information. So, before we get into things today, as usual, a couple of reminders for you. If you have a question about anything being discussed today, please call or email your faculty presenter during our live broadcast. The 800 number and email address are on your screen now and will appear again later in the program. Also, the handouts, sign-in sheet, and evaluation are all available online. You will need to register for this program in order to access those materials. Nurses, those of you watching for continuing education credit, I'm required to tell you the following. The ADPH is an approved provider of continuing nursing education by the Alabama State Nurses Association. The association is an accredited approver of continuing nursing education by the American Nursing Credentialing Centers Commission on Accreditation. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. Instructions on how to do this can be found at the bottom of the sign-in sheet. While content may continue to be relevant, CE credit will only be available for 1 year from today's date, which is April 22nd, 2014. There is no financial relationship between the planner of this program and the speaker. There is also no commercial support for this program. ADPH does not endorse any product that may be displayed in conjunction with any activity that might be demonstrated, nor will the department discuss any off-label use of products. As a reminder, the content of this program is based on the policies and procedures of the Alabama Department of Public Health, Alabama, and federal statutes, rules, regulations, and guidelines. Viewers not employed by ADPH should always check to clarify whether the content is accurate according to the statutes, regulations, and policies of your respective jurisdiction or agency. I'm Shirley Offutt, and with me today from the Division of Epidemiology is Tina Pippin. Welcome, Tina.
Thank you so much for having me.
Well, we are so excited that you're going to present this valuable information, and I know just going through some of the slides, there's a lot of things that I did not know. So I'm going to let you start us off here, and I'm just really excited.
Thanks so much. And one thing I do want people to take away, if you can learn one thing today that you didn't know before. You know, you hear presentations over and over, and you think, well, I have to watch this every year, I have to do this every year. This is a different program. This is about you, how to protect yourself and others. So for me, is making it personal. How can I take this information, and not just in the role that I perform for public health, but the role as a mother, a caregiver to a parent or a child, use this information. So look at it with those from that perspective. And we will be going through surveillance to talk a little bit about what epi or epidemiology, the division of epi, is. Because a lot of times I call and they go, I don't know who you are. I don't know what you do. So we'll talk about who we are, what we do, about the notifiable disease rules, facts and prevention on certain diseases, and we'll talk about foodborne disease outbreaks and another notable outbreak that we had this year.
Wow.
So looking at the Bureau of Communicable Disease, there are different divisions under what we call communicable disease. Epidemiology, HIV and AIDS, immunization, sexually transmitted diseases, and tuberculosis. So EPI's a little bit out there where, you know, okay, HIV, AIDS is fair, you know what they do. Immunization, we have the vaccine preventable, and then the vaccine preventable diseases that they do is as well as immunizations that they provide, sexually transmitted disease, and tuberculosis. So what is EPI, and what do they do? So we'll talk about that. The Bureau of Clinical Laboratories, they are a huge partner in everything that we do. And we have a listing of the different divisions within the BCL is what I'll say from now on, but BCL and the different locations. In Mobile, we mostly do the water, but under BCL in Montgomery, we have the clinical chemistry, metabolic, respiratory, sanitary, so much that the BCL does that we just aren't aware of. Another huge partner with EPI is our Bureau of Environmental Services. And you have the environmental protection, which is soil and on-site sewage, indoor air quality and lead, solid waste. Food, milk, and lodging is really probably our largest partner in what we do. Food, looking at restaurant, on-site inspections. They work closely with us on outbreaks. And lodging, also looking at hotels, the inspections they do there. Some inspect pools, and then also the spas related to that. So when we have an outbreak in a hotel, they're very important to have them as our partner. There's also the seafood and shellfish program within BES, as well as milk and quality assurance. And we work with milk on unpasteurized milk, and when we find out that maybe dairy farmers are selling that without being permitted, and that'll be something for discussion today. So looking at EPI in our division, we have the Analysis and Reporting Branch, which is our epidemiologist. These are our numbers. These are the ones that work with the data. We collect the data in surveillance. So the EPIs take that information and they tell us what's going on with the diseases. They look at trends. They analyze our data to say what's statistically significant and a possible culprit on an outbreak, a likely food or likely procedure. So critical for their support in looking at just regular disease incidents as well as our outbreak support. Healthcare associated infections, we have the Infected Healthcare Workers Program and which we call HAI program that looks at certain diseases within healthcare facilities like Coli, which are catheter-associated urinary tract infections. And these infections are tracked with each facility, capturing certain information and then reporting that through a national database. And this is a really new program in the last few years that we have a new grant and a new rule and law that was passed with every state, and Alabama as well. So surveillance, and we'll talk in depth about surveillance and what we do. Toxicology, Dr. John Garuska is our state toxicologist. He works with seafood, looking at the Gulf Coast oil spill. There's still lots of monitoring going on with water quality, shellfish, looking at any kind of effects related to the oil spill. Also looking at it, subject matter expert, if we have an anhydrous ammonia leak or a mercury spill or some type of what we call tox event. So his support environmentally, looking at what the risks are and what we need to do. Zoonotic, Dr. D. Jones is our state veterinarian. He consults with us on rabies, brucellosis, if we're looking at infections in cattle or other animals. He also works Department of Agriculture, just tons of looking at any type of disease within the animal that could cause a public health threat or a public health threat to the food chain. So very interesting for disease investigation and information that we work on daily. So what are we doing in EPI? Trying to prevent disease. I mean, this is a long mission statement, but really looking at all those different branches and the different areas that we're working, trying to look at the incidence and how we can prevent those, the prevalence, and try to prevent further infection. So when we look at disease, what are we really looking at? So this pyramid is, to me, is just a great analogy to say everybody has been exposed to an organism that could cause infection. and how well your immune system's working, how many hours you slept last night, do you have any comorbidities, if it's a food type, foodborne outbreak, how much of the dose, we call it dose, of the organism did you ingest? So all that is taken into account of whether or not you go make it to the next tier and you actually become ill. So if I become ill, let's say I have a gastrointestinal or a GI bug, am I going to go to the doctor? Majority of people are going to go home, self-medicate, rest, drink plenty of fluids, hydrate, or, take care of themselves. It only gets to the point as far as seeking care, one is like, do I have diabetes? And I'm concerned that this is going to cause additional health problems. Or I'm just not getting well. I've been vomiting for 5 days. I think something's wrong. I'm running a high fever. So let's say you seek care. Well, if you seek care and you're having vomiting and diarrhea, if you were in this room now and I surveyed you and said, when's the last time you went to the doctor that the doctor did a stool specimen on you? I doubt there would be anybody that raised their hand. Yes. Because generally you're diagnosed with a gastrointestinal disease, or, well, you've got a gastroenteritis, you've got food poisoning, something along those lines. And it's not saying anything, against physicians, but whether or not they see the public health, us trying to monitor disease and identify disease, or looking at, do I think this is something that would be an organism like Salmonella, Shigella, or do I think it's some of the Norovirus that we'll talk about later? Okay. So being able to identify that organism, confirming it as a lab, and then it gets reported to ADPH. Let's say the is a positive Salmonella. Well, do they report it to us? That doesn't always happen. So then, again, if it's reported to us, it's going to CDC. So we're only looking at a very small piece of the puzzle. There's so much disease out there. So when you look at, we're talking about investigations and cases, understand there's so much disease that we don't capture. But taking those considerations, that's why we don't know every Salmonella case or Shigella or some of the other reportable conditions. Across the state, we have our field surveillance staff, our epi nurses and epi staff that support us in our investigations and outbreaks. There's a map that's in your handouts as well as on our website for the contact person for your public health area. And they locally are the boots on the ground, do the investigation, follow up with the patients, the providers, and help us gather the information that's sent electronically to us and then to CDC. So they just do an just work so well, and a great resource and really great to work with. So investigations and cases. On our website we have this listed, and if you ever wondered and saw it, said, what's the difference? We do a lot of investigations based on laboratory reports or calls from physicians that never make it to what we call a case. A case is something that is through CDC, Centers for Disease Control, classification. So whether or not we can confirm it as a case, and there's other terms, probable, suspect, if it does not meet our CDC case definition, it's not a case. So we do over 5,000, almost 6,000 investigations, but we're looking at about 3,000 cases. So if we look at, we're doing 5,000 investigations, 3,000 cases. And that's only a piece of it. Think about, again, the numbers. Notifiable disease. One thing that we're trying to do to find out more of that, make our pyramid shift so that we have more cases, and that's not meaning we want more disease, but that we can know what's going on, is to really push about the purpose of the notifiable disease rule. Because it's to prevent disease, so providers know what to report. Confirm the disease, and it's required by law. So we'll talk about who's to report. The Administrative Code authorizes this, and ADPH is exempt from HIPAA privacy rules. A lot of my staff in the field and myself, when we make calls to facilities, they will say, well, that's a HIPAA violation. You'll have to send in a request for medical records. We'll have to get the patient to sign it. No. anything that we do in public health for investigative purposes, especially what we do in epidemiology, that they have a duty to share that to us so that we can investigate it and stop disease from spreading. On outbreaks, we work numerous outbreaks weekly, sometimes daily. We may have 5 cases reported to us, especially in vulnerable populations like the nursing homes, where we have high-risk populations, closed quarters. Norovirus is the top culprit. Norovirus is constantly circulating, so it is the highest of our confirmed outbreaks. Yes, we do have Salmonella outbreaks and other foodborne outbreaks, but generally those are few that we have those. But the norovirus, because it spreads so much person to person and because there's usually so many that are ill, those are reported more frequently. And we've been averaging, we didn't start monitoring this, and that's why you see 2011, yes, we had outbreaks before then, but we really didn't have the systems in place to capture this detailed information. So somebody said, well, how many outbreaks did you have for 2009? Well, I don't, you know, where we've had that information, we'd have to go back through all of our records. Now we have spreadsheets, and every time we get an outbreak, we put all of the information in a master line list, so that way we know what we're doing. We can identify problems, and we can really show CDC and our partners through our grants, this is what public health does. So who must report? So under our rules, we're looking at physicians, dentists, nurses, you, medical examiners, hospital administrators, nursing home administrators, laboratory directors, school principals, daycare center directors. So all of these are reportable, or reporters. And so let's say a laboratorian gets a positive lab and sees that it's Shigella. Then they should call us. Well, the laboratorian standard practice is they're going to notify the infection preventionist, which is an ICP, a nurse in the hospital. Well, then the nurse that ICP should call us. Well, then the provider should get their lab result back, so he should call us. We usually, if ever, get one report, because a lot of times they always think the other person's reporting. We find that regularly. So we expect and want multiple reports. If you, when you're doing your daily activities, find out information that somebody said, well, I've been recently diagnosed with E. coli, or, you know, I bring up Salmonella because we have so much of that. Then if you even heard that, you should call public health. So your staff, the nurses and others that are working as a reporter, if they've heard that information, you may be the first person that reports that to us. Because a physician may not think about it, may not be someone that regularly even thinks about calling public health, they just don't do it. So we really need you, if you hear that information, to look at what's reportable and to call us and let us know. And we'll talk about how you can do that. How to report. So if we look at immediate, extremely urgent, we're talking anthrax, botulism, SARS, God forbid anything happen type things. And generally that's a call from a physician or Bureau of Clinical Labs, BCL, that they've gotten a positive, or I get a call, there's a white powder event, they think it's anthrax, you know, something along those lines. It's generally should not be anything that happens that your staff or any of my staff should hear about it in the field. Immediate urgent, so this is meningitis, hepatitis A, those type of are the regularly the ones that we see, Haemophilus influenza. They should be reported within 24 hours of diagnosis, and that can be done online through our report card, through the phone number that you see listed here, the 1-800-338-8374, and that's a 24/7 phone. So we always have somebody on call to receive reports, or a report using the email. And people can fax. We get fax lab reports that are sent to us. Standard reporting, so our enteric diseases, our gastroenteritis, some of the other diseases are like Listeria, my mind just went blank. Some of our just common diseases that we see frequently that don't have such a public health threat, that they can be reported within 7 days. So not as concerned, but definitely need to know as soon as possible. So it can be through the online reporting, the phone, email, or the fax. This is a screenshot of the online report card. It can be found on our web page under Report, and this is the report card. So these are the fields that are required to report, and it's easy for anybody to go on and send this through. It comes in every day to a secure email, and it's sent to my office, and we go through, and every one that we get, we report it. And we do get reports from public, and we follow through because it may be a patient self-reporting, and that may be the only way we ever find out. This is information about county health department, just for sometimes people may not know how to get in touch with their county health department staff, our FSS, so they can have the website to find the map, as well as our epidemiology page. So what information we should receive: the diseases being reported, the patient's name, date of birth, and gender, address and phone number, and that's critical because our patients are investigated according to their patient address. So how that's assigned and how it comes into our system is based on the patient's county of residence. The date of illness, so the date of illness, sometimes that's the laboratory report, but that could also be a physician diagnosed as meningitis. If someone comes into the emergency room and they have stiff neck, they have a rash, and the doctor says this is meningitis, then we would have that. But generally it could be just the lab report. Again, not violating HIPAA in any way by sharing this information. It is required. So now let's talk about diseases. So we're going to look at facts from the myths, how diseases are spread, and how to prevent yourself and others from becoming sick. And this shows diseases that we will be going through, organisms that we'll be reviewing today. This is just from a standpoint of what we get the most calls. That's why these diseases were selected, because one, we either felt that these were diseases that people really needed to have information on because of the severity, or it was the most frequent in what calls that we received.
Okay, Tina, let me start here. So are you saying that any of these that are listed on the slide here are reportable?
Yes. Everything that's listed here are reportable conditions. Well, influenza flu is not reported unless it's a novel virus, and that is something that would, let's say that somebody tested positive for flu and they'd send that to a lab, and it could be LabCorp or some of the others that could do typing for what we call, you hear flu A and flu B.
Right.
Those are seasonal. But let's say they tested it and they couldn't identify it as flu A and B. Then we're looking at, wow, are we looking at a type of novel influenza? So then that is an urgent, get it to our state lab, get it to CDC. So those are a call as soon as possible. So that's on our report card, it says novel influenza A. So a lot of our providers call and say, I've got a type A, which is not reportable. So we are clarifying that because we're updating our rules. But influenza is only, pediatric influenza deaths are the only thing that's reportable right now. And pediatric is under the age of 18. Pediatric deaths.
Okay.
That was a great question. From the flu.
Okay.
So let's start with botulism. So Clostridium botulinum is a bacteria that can be found in the soil. It is not spread from one person to another. It affects your nerves, it paralyzes you, and it can cause death. And you hear about botulism, you think food, but food botulism is very rare. So when they had the Castleberry's chili, where the food was contaminated, that's probably one of the most notable. And we did have a case here in Alabama that was a death from that. But it is extremely rare. But foodborne is eating foods that are contaminated with the toxin called botulinum toxin. So there's a toxin in the food that causes the illness. Most foodborne botulism cases are caused by caused by home processed foods and home canned foods. Wound botulism, which we rarely see, is associated mostly with black tar heroin injections. So the two pictures that you will see, this is an infant with botulism. You see the stiff neck or the head lag. So infants lose the ability to hold their head, and it will just, you'll see a wobbly head. You'll also failure to thrive. The infant will not eat, severely constipated, and the mothers may think, well, I just got a fussy baby at first. Well, then it starts showing these additional symptoms. So by the time we get to the emergency room, we generally have pretty involved disease. And on the right, you'll see case of heroin injections. So, you know, where they'll inject wherever, and this shows in the leg where they had botulism, and generally will lead to amputations.
Now, how would this have happened to an infant?
We're going to talk about that. That's
Okay.
a great question.
Okay.
So when you open a jar of commercially or home canned foods, thoroughly inspect the can or jar. I think people understand that, but you must understand that it is something that you should do. And some of this, when I read them, you're going to think, why are you saying this? But do not taste or eat foods that are discolored, moldy, or smell bad. And I put this in here because, I mean, that is one of in the CDC fact sheets, it does include that. But because I don't know how many outbreaks I've worked that they said it just didn't taste right. And then I asked my husband to taste it. Don't do that. I mean, you may be upset with your spouse, but don't expose them to something that, if it doesn't taste right or smell bad, please, I mean, there's no need for anybody else to confirm your analysis. Do not use products that spurt liquid or foam when the container's open. That is high probability of contamination. So always throw it away. I don't care how much it costs. It's not worth it. It's not worth your life.
And Tina, I've heard this, and you may be getting to this or whatever. If you see cans that are really dented.
I personally don't buy dented cans. I don't think it's the dent as much as that you see the can that's bubbled up.
Yes.
That's more a risk than a dented can, but I personally don't like to buy dented cans because I just think, what has it been through? You know, I think about the integrity of the can. You know, if it's dented, is there a way that there could be a seal, even a small open area that's not visible to the eye that could have introduced air or other, and there'd be a problem. So
well, and I have bought perfectly good cans, and I would bring them in the house, probably my hands loaded too much, and maybe drop a sack or whatever, and the can dent.
It's perfectly fine to use it.
Okay.
That's a great question. The other things we talked about spurting, and we're going to talk about pressure or cooker. So when you use a pressure can or a cooker, you need to make sure you follow the instructions. There are instructions there to protect you and others, and especially with the processing times. You need to pay special attention to processing times for low acidic vegetables like green beans, which are one of the biggies, carrots and corn, because they are the ones that you really have the most common if you don't process them correctly. And then boil home processed or low acidic canned foods for at least 10 minutes before serving. It's a must. So how do babies get botulism? So children less than 12 months old should not be fed honey. Honey can contain the bacteria that causes baby botulism. And I know because I've worked in clinics, worked in the health department clinics, I worked in the emergency room, all different. When a baby's fussy, I always say, well, add a little honey. And that's how babies can generally, I've had cases where they add spices from different countries. There's different cultures that they have remedies for a colicky baby. So I've seen a lot of things introduced to an infant that could cause harmful effects like botulism. Also, if you buy oil-infused garlic or herbs, those should always be refrigerated because they can also have the toxins. So make sure that you refrigerate those. when I was doing the investigation to pull this presentation together and look at cases of botulism in rare instances, looking specifically at food, found that baked potatoes could be a risk as well. So potatoes that have been baked while wrapped in aluminum foil should be kept hot until served or refrigerated. And you should make sure the potatoes are eaten within 2 hours of being cooked at 60 degrees or 147 degrees Fahrenheit or hotter, or refrigerate the potatoes within 2 hours of being cooked. And I see this a lot at church events or some kind of large meal preparation where they'll bake a lot of potatoes and they'll have them wrapped and just stacked. And they may just be stacked on a table. So you actually could be putting people at risk for that. So just for you to know, if you're involved in that, or for preparing for your family, let's make you're having everybody over for steak and potatoes, usually you're eating within 2 hours, but you just don't know. So this is a risk and it's something you should be aware of. So moving on to Salmonella, probably one we hear the most about. It's a bacteria that affects the stomach and intestines, sometimes diarrhea, stomach cramps, and fever. So usually going to see fever and sometimes can really be high. Symptoms usually begin 12 to 72 hours, so a pretty quick onset. And an onset is from the time you're exposed to the virus to the time you become ill. So onset are what we call incubation period. So that incubation period from the time you're exposed to the time that you become sick, 12 to 72 hours. And most people get better within 5 to 7 days. How does it spread? Can spread water to person, swallowing infected water. Somehow salmonella is in the water. Maybe you're in a pool that's not chlorinated well and somebody has diarrhea, or a pond or other area that could have somebody that's ill or have salmonella. Animal to person. We see this frequently in our investigations. Contact with animals, specifically birds, rodents, rat and mice, and reptiles, lizards, snakes, and their feces. So, you know, some people want pet mice. My son at one time wanted a pet lizard, and I said, absolutely not. Because if you think about it, you give, let's say you give your child a pet lizard. Usually when you ask your child to have the pet, what do you tell them?
You got to take care of it.
Very good. You got to take care of it, and that includes cleaning out their cage or their aquarium type, whatever you want to call it, and they're going to be exposed to the feces. Now, every child I've ever seen, including my own, do not wash their hands well, unless they're OCD germaphobe. Nothing against that, because I am, but they're going to be, if you clean out that and then they go to eat or do something else, that's how they get exposed. So that's what we find is one of the biggest indicators if they've had some type of animal like that. So food to person, eating undercooked meat or eggs, and my husband eats raw. I mean, those runny eggs all the time, and he's putting himself at risk. Ooh. So understanding that it can be in the meat, not cooking chicken and eggs well. We've had people to call and say, will you test my eggs? I think my husband got salmonella from the eggs. And when you ask how they're prepared, well, sure, they eat runny eggs, and we know that salmonella is in eggs, so understanding that you put yourself at risk when you do that. Consuming food or liquid handled by a sick person who didn't wash their hands well. People can shed salmonella for months.
Really?
Months. We've had positive salmonella test results on people up to a year. So even though you're not symptomatic, you could be shedding the bacteria. So preparing food, if you don't wash your hands well before you prepare food, you could, in fact, infect others. Or drinking raw, unpasteurized milk. And we'll talk about raw, unpasteurized milk in a little bit. So how do you protect yourself? Make sure you cook your chicken, ground beef, and eggs thoroughly. I suggest buying a thermometer. I'd never tempt my meat, or just never thought about it until I worked Epi. And so we have a quick sheet that is on our food, milk, and lodging. It's a cook temperature chart. It is great to have as a resource about how long you should cook your meats, to what temperature.
Oh, I know. I just eyeball it. If
And we're going to talk about eyeballing something. You're going to see. You probably never do it again. So do not eat or drink foods containing raw eggs. That's why I say, like, don't eat raw cookie dough that we all love to eat. Well, a lot of us. Raw or unpasteurized milk. Eat undercooked meat, chicken, eggs in a restaurant. And you'll notice in restaurants there should be a disclaimer that says you put yourself at risk if you order it that way. Washing your hands after handling reptiles, birds, baby chicks. They're cute, but they will give you salmonella. I mean, that's why you have it in eggs. That's why the chicks, they're just precious. So pet feces and pet food. We have had pet food that is contaminated with salmonella. We have had cases that we found the mother would feed the animals, or other parent would feed the animals and then come in and prepare food or feed the infant. So they actually would contaminate their hands from the pet food, and the pet food we knew they were linked to an outbreak of salmonella in pet food. So avoiding holding reptiles and then working with infants or persons with health problems. So this is something to think about when you're in the homes. Any kind of, if they have pets around the home. I mean, you could be putting yourself at risk if not understanding how well they may be taking care of their cleanliness, and that salmonella could be there.
And it's a good opportunity to teach the family and the patient.
Absolutely.
You know, about how to protect themselves.
Exactly. So very great, very good point, and something that we do have on our website as well, a salmonella fact sheet that you can hand them as well. Do not work with raw chicken or meat and, then go feed your baby or change the diaper at the same time. And I know these things sound commonplace, but they're here because we've seen it happen. Shigella, another bacterial disease with stomach virus, diarrhea, often bloody because you have a lot of it, fever, stomach cramps. Usually it starts a day or two after being exposed and will resolve within 5 days. And it spreads well, very well, person to person. Once Shigella starts, we've had Shigella outbreaks in communities where it just starts and it just spreads all the way through the county. And it seems like every school system, everybody will have it. So it takes very little to make a lot of people sick. So infected stools on the soiled fingers from person to person. And people just don't have good hand washing technique. And we all get in a hurry, and that's everywhere we go. And that's why I will always have a job.
Well, and I'm like you. I am OCD when it comes to hand washing. I mean, it's a pet peeve with me.
Well, and that's some of what we work with and understand. And unless you kind of exposed to the type of environment where you know a lot about this, people may not understand the risk. And that's one of the reasons that our nurses are doing this presentation in the community to churches, civic groups, nonprofits, fundraisers, so that they can understand the risk. Shigella can be present in stools while they're sick and for up to 2 weeks after. So like salmonella, Shigella is still there, even though symptoms are resolved, and can be there for up to 2 weeks. So usually we see that siblings will pass it to each other. So children should be kept out of daycare and schools. Supervise hand washing of toddlers and small children after they use the bathroom. So critical, we really push this in daycares. They have one case of Shigella. We make sure that they know that first they clean very well, but making sure they watch the kids wash their hands, critical. And you should never prepare food while you're sick, and with Shigella for at least 2 days after your diarrhea has stopped. So you may feel better. So for 2 days after a positive Shigella, no food preparation. And avoid swallowing water from ponds, lakes, and untreated pools. That's a high incidence also. Norovirus, hear a lot about this. So this is the food poisoning, the cruise ship virus, the stomach flu. This is the one we see the most, and I'm sure everybody that's watching this has had it at some point. Severe stomach cramping, vomiting, and diarrhea often begins suddenly. I mean, 1 minute you're okay. You may kind of feel I just don't feel right. The next thing you are puking everywhere. I mean, it's just, it comes on so fast, and it's severe. You know it when you have it. Most people, they have it, it's awful, awful, they can't stop, and then they wake up the next day, they're fine. Great thing, you can get it more than once.
Oh, well, that is great news.
Most of these you can, but norovirus, people say, well, am I immune to it? Nope, you're not, and there's many different strains that you can encounter. How does it spread? Caring for sick people, sharing food, drinks with others, eating food or drinking food from somebody that's sick, or touching a surface or object handled by a sick person and touching your mouth. So norovirus would live on this. Let's say somebody came in here, didn't wash their hands well, and then, for some reason, maybe I felt like I had something in my tooth, and then I touched my mouth. I mean, it could be something as benign as that. That's why it's important that you wash and cook foods thoroughly before eating them. Ill people should not prepare food 3 days after they stop having symptoms. Clean and disinfect surfaces after contact with a sick person with bleach. My husband got, and I'm sorry to talk so much about my husband, but I think real life scenarios are the best.
Exactly.
He got norovirus at Disney World. Wasn't anything he got at Disney. That was when it hit him. We closed him up in the bathroom. I said, you do not come out. You sleep on the floor, whatever. And that sounds awful, doesn't it? But I mean, I was throwing him water and stuff, but we were at Disney World. You know how much you pay for tickets, so you're not taking a chance for anybody else to get sick. So we called up housekeeping and said, I told them, I said, I have a person that has norovirus. This is going to it could get your cleaning crew sick. It can get everybody. We need people to come in with bleach and water. And they came in and they cleaned the place down. And that's what you need to do. I mean, if you have a family member or, treating a child that has this, you need to watch, protect yourself, and then you've got to clean with bleach and water.
And these wipes, not to mention any name brands or whatever, but the antibacterial wipes.
Antibacterial wipes, yes, soap and water. I mean, I always say bleach and water if you can bleach and water. If somebody's been vomiting and had diarrhea, the bathroom should be clean with bleach and water. If you're sick, you should always, also soap and water, no hand sanitizer. Hand sanitizer does not work against norovirus. So you got to switch. And any time, and we're going to talk about this later, if you can wash your hands with soap and water, you should wash your hands. The only time you should use hand sanitizer is if there's not soap and water, period. With norovirus, you wash the clothing, sheets, towels, so it can live on anything, with soap in the wash machine for the longest cycle and put them in the dryer. And that should be done as soon as possible. So E. coli, so that's a bacteria that, again, affects stomach and intestines. E. coli is one of those that just scares me. It's just really bad because high fevers, you can get, as you'll see here, can lead to life-threatening illnesses. Children get it, they end up on dialysis and die. How does it spread? Drinking water, untreated water. We had an outbreak in a water facility where they had not properly chlorinated their water. And how the E. coli got there was sure somebody was sick with E. coli and had diarrhea in the pool. It was in the pool, like a splash pad and another water source. We had people that were positive for E. coli and all that had been swimming in all those different areas. Wow. We had children on dialysis, and E. coli will die in chlorine within 15 seconds. So if chlorine levels are kept at proper levels, you should not ever have E. coli from a swimming pool or any kind of pool like that. So
what about the salt pools?
That was the question asked last time.
Really?
It was. She asked the same question. And I'm going to have to research that because I don't want to answer that and not be absolutely sure.
Because my son has a salt pool, and I'm thinking of this, and I know the dog gets in there. It's a small pet, and he'll swim around, and I was like, oh, me.
And I'm not sure the risk, to be honest. From what I understand, there are ways that they treat the pools the same, but I don't want to. Okay. I'll have to follow up on
I'll
that.
be waiting
Send you
for
an
your
email,
email.
and you send it out to the staff, okay?
Will do.
Okay, so, of course, caring for sick people with vomiting and diarrhea. Eating foods or liquids handled by a sick person, unpasteurized milk. Again, to me, you should never drink unpasteurized milk. And people say, well, why is there unpasteurized milk? Because there's a lot of going back to nature, going back to things that aren't processed so much. Well, there's a reason we have pasteurized milk. That is to protect. But it's the thought of, it's kind of the organic, eating things that are from the farm.
So if I go in the store and I see organic milk, I need to look on there to make sure it was pasteurized, or what?
There is, it will say unpasteurized milk. You have to make sure that you look. And
in small print, or am I going to find it? I mean,
well,
am I going to have to research this? Because
usually
I
it's
do
small.
drink organic milk.
Well, you'll need to look and make sure, because some of
Really?
the organic is
Wow.
unpasteurized and some there's just unpasteurized. So that's something you need to look at,
Okay.
because you could definitely be putting yourself at risk. Again, with E. coli, petting zoos are a risk as well. So if you have young children, or you go to a petting zoo, to make sure that when you're feeding the animals, that you don't then put your hands in your mouth.
Now, at the petting zoo, and I know my grandson, I take him, and he does like to feed. So, and I always carry the hand sanitizer.
Now,
Is
for
that
E.
okay with E. coli?
It should be okay. The norovirus, it doesn't, but E. coli should be okay, and Salmonella, E. coli, and those others for the hand sanitizers.
Okay.
Very good question. For E. coli, based on what we had with the outbreak at the water facility, any child that has had E. coli should not swim 2 weeks after the diarrhea has stopped. And this was an outbreak that occurred during the summer, so it was imperative, because this was a lot of different daycares. It was like a daycare day, and all these kids went to the water park or went to this water facility. So we had to make sure that none of those kids swam for at least 2 weeks. And it's something to understand, because you're still at risk, or still could put others at risk. Always take your children to the bathroom for bathroom breaks. No child that's in a pool is going to say, Mom, I need to go pee. I mean, it's just not going to happen. You're going to have to make sure that you're the parent and checking those diapers often. Don't change diapers at the pool side, and, trying to understand and get the kids to make sure they don't swallow as much water. How you do that, you tell me. But understanding that just is a risk. Food concerns. Cook ground beef and meat to at least 160 degrees. Use a thermometer. Avoid raw milk, dairy products, and juices like fresh apple cider. And that you see this warning label. This product, and I can't because I'm forced.
Has not been pasteurized.
Right. Okay. So that's the warning labels that will be on the product.
Okay.
So prevent cross-contamination in food areas. So just making sure your cutting boards, your utensils that you use, anything. You don't need to use ready-to-eat foods and raw meats and others. Hepatitis is an inflammation of the liver. Occurs as a new infection. It is not chronic. It's very common in other countries, not as common here. B and C are, can be acute or chronic. Transmitted through activities using balls, puncture through the skin, mucosal contact with infectious blood or body fluids. Food and water. Sharing eating utensils, breastfeeding, hugging, kissing, hand-holding, coughing, or sneezing. So for hepatitis A, usually when we're trying to prevent further people from becoming sick, we're looking at, have you shared any foods, or have you kissed? It's really bad if we have a positive teenager. So trying to think, girls share everything. And so you're looking at, how it could spread. It doesn't have to be somebody necessarily that eats and lives in your household, but it can be close friends. So ingested stool, even in a microscopic amount. So it's not just the food that's contaminated, it's that person may not have washed their hands well and had poop on their hands and then contaminate the food. That's how it occurs. Again, not washing their hands thoroughly. Or if a caregiver doesn't wash his or their hands after changing diapers. And we talk about with children, but this is also with adults. So any adults on diapers that have, that's the same risk as we talk about diaper children. And contamination with hepatitis A can happen at any point. So we talk about growing, harvesting, processing, handling, and after cooking. So when we're talking about food, you hear about the spinach and these, which,
right.
E. coli is, the harvesting was that there were cattle that, they had their feces, and then there was rain, and there was what we call runoff. It ran down the hill into the spinach farm. Well, let's say it's on the product. So that's why cleaning your food well is just critical if it's a ready-to-eat food.
Now, that picture is going to stick in my mind forever
Good.
with spinach.
Very good. I am so glad. Fever, weakness.
I may never eat it again.
I know. Well, they had the E. coli outbreak when I was really trying to get my son to eat green leafy vegetables, and spinach was something he ate. And at the time, I was really concerned for him to eat it because it's just something that's so high risk. So hepatitis A, fever, weakness, loss of appetite, nausea, vomiting, gray-colored stool. You'll also see, I did the wrong button. Sorry, y'all. Abdominal pain, dark urine. You'll see the yellowing of the eyes, the jaundice, or the skin. Symptoms are more likely in adults than children. A lot of times in our children, they're asymptomatic. So if we hear about a parent, usually we'll test the children to see if they're positive. Great thing is, you've got vaccine now.
Yes.
We didn't have that. So now the children are if the parents don't think that vaccine, have refused to get their children vaccinated, they're protected. I recommend hepatitis A vaccine for anybody with international travel. If you're doing mission trips to underdeveloped countries, you should get your hepatitis A vaccine. And you have lifetime immunity. It's only 2 shots, 6 months apart, and you're protected. The physicians usually will say it's not needed. It is, because I've seen too many mission trips where people came back with hepatitis A. So there's no risk in it. Mm-hmm. So washing your hands thoroughly. Loose stool should not be in child care facilities until it's resolved. Making sure you wash and protect the counters and surfaces with soap and water, especially raw meat or chicken, and making sure before you prepare food for high-risk populations like infants, elderly, any of those with health problems, protect them. So making sure you really wash your hands. Flu, influenza, is contagious respiratory disease, affects the nose, throat, and lungs. 2 main types are type A and B, so that's what we see the most. Routinely spread in people responsible for our seasonal flu, and seasonal flu, believe it or not, flu is always here. We have a flu season, it's just when our peak. So flu is always circulating. The seasonal is when it makes it through the other countries and starts coming back around. So as it spreads from the different hemispheres, that's when our seasonal flu generally begins in October. So droplets can land in the mouth or noses of people that are nearby. You may be able to pass on the flu before you even know you're sick, and definitely while you are sick. So you can infect somebody beginning day 1 and up to 5 to 7 days after becoming sick. So symptoms range, and you know this based on if you've ever had the flu or patients you're taking care of. Fever, cough, sore throat, runny nose, aches, headaches, fatigue. Some people may have vomiting and diarrhea, though it's really more common in children than adults. And certain people are greater risk. And, pregnant women, older adults, those that are a risk for every kind of other disease, that have conditions that just decrease their immunity. But especially those in a nursing home and those closed environments. Best thing to do is get vaccinated. And I know that people are, hesitant to get the vaccine because they say it makes them sick, but the vaccine works. It is not shown to cause illness. You may have some local reaction. I know mine was really sore this year. But, that's the best way to protect yourself. Wash your hands, cover your cough and sneeze, never with your hands. either with a tissue, a handkerchief, or your sleeve. Stay home anytime you have a fever, but especially with flu. Clean and disinfect areas after, if you have someone that's sick or if you're sick yourself. And if you get worse, if you're being treated for flu and your symptoms don't improve, you should always call your doctor, because flu can quickly change into other existing, like pneumonia, other diseases that can make you severely ill and even cause death. So if you're not getting better, you should always call your doctor. Again, this is cover your cough. I don't know if y'all use masks a lot in home health, but if the patient's sick, definitely cover them with the mask while you're there.
And the clinicians and the aides do have them available.
So use them. Don't worry about hurting somebody's feelings. It's not about feelings. It's about protecting yourself and protecting others. I don't want to get sick. I will walk around on a mask all day long. I even sometimes carry one with me, to be honest. It's like you get on the airplane, and if the one person that's coughing is going to be sitting next to me, for sure. So if I can change seats, I will, because you just think about all those droplets going everywhere. But definitely when you're in the home, protect yourself. If they're coughing, tell them that, because they're coughing, they could be coughing droplets or however you need to say it for them to understand it. Because you're coughing, I could get sick, and I want to make sure I can take care of you. So I'm going to put this mask on while I'm checking, listening to your heart, or taking your temperature, or whatever activity where you're in close contact within 6 feet of the patient. So,
and not only, and it is, protecting yourself, but our nurses and our aides and our therapists, they go from home to home to home.
Oh gosh.
So, you're talking about several people in one day that could become infected.
Right. So that's not a good thing for anybody involved in the circle of life. TB, I just put this here. I am not a TB expert. I know what TB is. It's a bacteria affecting the lungs, and it's much like influenza spread through the air. As you'll see in this, it's droplets, and the person, when they cough, sneeze, speak, or sing, and for anything for the other person to inhale. So a visual now, whether or not this person really sneezed, and I'm going to take it that this was full, that's when they sneeze, that's what it looks like. And that's just, to me, if that's how many droplets just on a sneeze, that's why you just want to make sure you protect yourself. So symptoms, and this is just for you to know, because, and I know that probably with your infection control you get this again, but cough, feel weak, fatigued, unexplained fever, unexplained weight loss. So these people are ill. They are low sick, what we call. So they've lost a lot of weight, they're coughing up blood, they're having sweats at night. So TB is not something that comes on, well, maybe I have it or maybe I don't. I mean, when you have TB, you are sick. Vibrio. Vibrio is a bacterium, and usually what we see in Alabama is vulnificus and parahemolyticus. It's rare for cases of cholera to be in the United States. If there's cholera, they've traveled, they've been exposed to other sources, other countries. We just don't have, thank God, we don't have cholera here. So symptoms are water diarrhea, abdominal pain, nausea, vomiting, fever, usually 24 hours after they've ingested the bacterium. It can be in a wound, and it can cause skin breakdown and ulcerations. It is naturally found in warm seawater. So all of us that travel to the Gulf Coast, in that warm, salty water, you can find Vibrio. So how to protect yourself? Shellfish. Majority of our cases, if not all the cases, have eaten some type of shellfish. So your oysters, your clams, and mussels, you have to make sure you cook them well. For shellfish in the shell, boil until the shell's open and continue boiling for at least 5 minutes. If you steam them, make sure they open. and continue to cook more than 9 minutes. So if the shellfish do not open, you do not eat them. So if you're cooking them, again, and the shells don't open, you don't eat them. It's like you don't eat the can that spurts liquid. You don't eat a shellfish if the shell doesn't open when cooking it. If you boil shucked oysters, you should do it for at least 3 minutes or fry them for at least 10 minutes at 375 degrees. Avoid cross-contamination of cooked seafood and other foods with raw seafood and juices from that raw seafood. And you should eat shellfish promptly after cooking and refrigerate any leftovers. So looking at the wound, avoid exposure of open wounds or broken skin to warm, salt, or brackish water, or to raw shellfish harvested from such waters. So I'm going to ask you, do you go to the beach?
I do.
So what's something when you go to the beach you usually always do before you go down to the beach?
I put some sort of sunscreen or something
Sunscreen
on
on.
me.
Do you do anything to your legs?
Well, as a female, I shave my legs.
Shave your legs. Very good. And what could happen when you shave your legs?
Well, you're going to get cuts.
Okay,
which is going to expose you.
Okay, very good. You're a very good student. I am so proud of you. So, I never thought about this, but you can, and just usually what I'm going to do is I'm going to shave, and then I'm going to go down and jump in the ocean. Well, you got that open area and that warm, salty water. You've opened yourself up to, and you can see this person with severe ulcerations. We have seen bilateral amputations from Vibrio, and even death from a wound that caused systemic infection, sepsis, and death. So it's not something to play around with. So when you're working with shellfish, you need to wear protective clothing, gloves, anytime. You should never handle shellfish without gloves. So switching again to tick-borne diseases. We do have ticks. Everybody knows, I'm sure you've pulled them off animals that you've had at some point, and they can cause illness in humans, and these are listed, some of those. Most of what we investigate are Lyme disease, Rocky Mountain spotted fever. Do we have that here as what we call endemic, meaning within Alabama? Generally not. Lyme disease is endemic in certain counties because we've had more than one case in that county. But a lot of these diseases, we don't have those ticks here. And a lot of it has to do with how the population of deer and other animals migrate. Once those animals migrate, maybe they come down this way as the environment changes, they could bring those ticks here. So we're always looking. That's why we do the surveillance. So symptoms can be very vague. Fever, chills, aches and pains, and rash. The one thing that's not vague is what's called a bullseye's rash. This, you can definitely see the bullseye.
Yes.
There's no, when people say, I'm not sure if I had it, if you don't know that you had a bullseye rash, you do not have a tick-borne disease. So it's circular, usually a skin ulcer, and it has that huge red spot in the middle. Can be just non-itchy spots, but generally we're going to see the bullseye. And it's after being bit by a tick. Symptoms may develop a few days or maybe weeks later. So some of the standard precautions, just making sure, because they live in wooded brushy fields and high grass, that if you don't want to be exposed, you just avoid those areas. I mean, if you're a hiker, you're going to need to make sure you walk, center of the trails as much as possible. If you're an explorer and you like getting off the trail, you're going to have to make sure that you protect yourself by using some type of repellent.
And one thing that really concerns me, I know I speak personally too.
That's what you should.
Is my grandson is a Cub Scout, and they go camping.
And we're going to talk about everything that you need to do to protect him.
Well, I know he has a lot of those products because I buy them.
Yeah, and he needs to put them on. So after outdoor activity, bathe within 2 hours, and you need to conduct a full, it sounds like a full body, like a kind of like a full body cavity. I'm not talking about that. I'm talking about check. So you check, the clothes, the pets, the gear. You should tumble dry the clothes on the highest heat for at least 1 hour in case you miss the ticks. What you need to check is in the arms, around the ears, on the back parts of the ears, belly button, inside the belly button, behind the knees, between the legs, around the waist, and especially in their hair. And generally you'll see it at the base of their scalp. And the picture that's shown here is how to remove a tick. You should always use tweezers, something you can really get a good, and I mean good tweezers, not those that really don't clamp together, that will clamp down, and when you should remove straight up, so that you should remove the tick straight up so that the head is not left in the skin. You don't want to jerk at it. You want to remove it and pull straight up, because you don't want to break off and the head stay in the body, in the skin. Mosquitoes transmit several diseases. They infect humans and animals like dogs, birds, and horses. 1 in 5 people infected will develop fever, headache, body aches, joint pain, and or weakness. A lot of times they just think they feel bad. They think, well, maybe I got a little case of the flu in the summer or something like that. They don't think West Nile fever or West Nile encephalitis. Well, you know it when you have West Nile encephalitis because you start developing neurological, but the West Nile will progress to that. So West Nile cycles between mosquitoes and birds. So I put this picture here because you have the mosquito that will go, and then they'll take what we call a blood meal. They'll bite the bird and ingest that blood, and then after doing that, that organism, that virus starts to grow. So a mosquito just doesn't have the virus itself. It has to obtain the virus from the bird. And so then they'll have it sounds awful saying blood meal, but that's the term we use. Then they'll bite a human or a horse or another mammal, and that virus, after it's grown, that's how we get the West Nile virus. So there's a cycle. So birds develop high levels of the virus in their bloodstream, and mosquitoes can become infected by biting those infected birds. So it cycles between the bird and the mosquito, and then we're exposed after it's cycled between them. Mosquitoes with West Nile virus also bite and infect people, horses, and mammals. Mammals do not develop high levels of virus in their bloodstream and cannot pass the virus to other biting mosquitoes. So that's just good to know, because people have been concerned, and mammals being any of us, people, horses, any type of mammal. We can't develop West Nile fever and then transmit it to someone else. It's not possible. So that's just good to know, because we've had people call and say, well, this mosquito bit this person that had HIV. I know he has HIV, he got bitten, and then the mosquito bit me. So mosquitoes can't carry viruses like HIV. They can't bite somebody and that person get West Nile virus, and the person say, well, you know, then I was exposed to him as well. It's not the way it happened. So there is some confusion sometimes about how the virus is spread. Rare cases, it can be severe. Severe stiff neck, high fever, disorientation, seizures, coma, paralysis, and death. It does not carry, mosquitoes do not carry, as said, HIV, AIDS, leukemia, hepatitis. It is not possible. So the best way to protect yourself, stay indoors, dusk and dawn. I don't go outside. I mean, mosquitoes love me. I hate them. I mean, they will eat me alive. So I try to, if I'm going to be out, if I can avoid those times of the day, dusk and dawn, because that's their time. They're really out there breeding and eating. If you wear clothes, tightly woven, loose-fitting clothing with insect repellent, because you don't want them to be able to, tightly woven clothes, they can't bite through the clothing, because mosquitoes will bite through clothing if it's not a tight weave on the clothing. And you need to make sure you wear enough insect repellent to cover the skin and clothes, containing usually DEET, you'll see, and these are the other ones, mostly DEET's what we see. You should never wear repellents under your clothing or put them over cuts, wounds, or irritated skin. And if you're going to put it on your face, make sure you spray your hands first and then apply to your face. You don't ever get it in your eyes, your mouth, and sparingly around the ears. So just understand that. And children, apply the repellent to your own hands first and then put it on the child. And when you return indoors, you should shower, because you don't want that chemical. I mean, you got to think this is a chemical to stay on your skin. So I don't think people think about that. Sometimes you spray down and you think, oh, well, it's not, I've worn it off. You really haven't. That chemical is still there on your skin. You should always bathe after you've sprayed with mosquito. Controlling it around your home. So screens should be kept, without holes, in good repair. Containers that collect water, buckets, cans, and bottles, anywhere around your house should be removed. Leaky pipes, outside faucets, unclogged drains and gutters. This is a wheelbarrow full of water. Any kind of container with water should be emptied. Empty and scrub bird baths, pet bowls, and animal troughs to get rid of mosquito eggs. So you won't necessarily see them, so think about that. These are areas that the eggs can be there and they can breed. Discard unused tires, wheelbarrows, tubs, wading pools, or store them under covers when not in use. Keep weeds, vines, and grass trimmed, best thing in the world. And then tree holes. You may not think about this, but if you have tree holes in your yard, you need to make sure you cover those with sand because they will get in there and mosquitoes will breed there. If you have water and pots, any holding flowers, you need to make sure that you change that twice weekly. Rabies is a deadly disease caused by a virus that can infect warm-blooded animals. Prevention is considered the only treatment. Once the symptoms appear, it's fatal. I've had people call me and think they were exposed to rabies, and they said, what symptoms am I looking for? I said, if I tell you the symptoms, you're too late. So it's spread through saliva of affected animal. This is very important. So it's in the saliva, not in the blood. So any scratch or bite that's fresh cut that's exposed to the saliva or brain tissue from an infected animal. And mostly we see it in raccoons, bats, and fox are the main carriers. So make sure you keep your animals vaccinated. It is critical. Do not touch or feed wild animals or stray animals. I know your heart goes out to stray animals. You shouldn't get close to them. You put yourself at risk. And wild animals are not your friend. I don't care how much you throw bread out to them, feed them every night. They will turn, and one day the raccoon you've been feeding for 2 weeks will bite you. And that may be the time it has rabies. So it's not safe. Don't do it. And you should keep your pets close to you. I mean, they shouldn't run free because you don't know what they could be exposed to when they're not with you. Very important. If an animal is attacked, if your pet is attacked by a wild or stray or unvaccinated animal, do not avoid contact with the saliva. So if your dog is in the yard, raccoon comes up, it's not acting right, and attacks your dog, you have to separate yourself for a minute. I would keep a pair of gloves somewhere outside. It could be just your work gloves, when you work in the yard. Put that on before touching your dog to check them for injury, because the saliva that's on your dog, that's from that animal, if it gets in, like I have a paper cut right here, if it got into that paper cut, I've been exposed. So it's important to know you're not exposed to blood, you're exposed to saliva. So it's very important. And then make sure you wash your hands with soap and water. So again, vaccinate, don't stay close to wild animals, and make sure you protect yourself. Scabies, infection of the skin by human itch mite. Every time I say this, I start itching. It burrows into your upper layer of your skin and lives and lays eggs there. And generally does not survive more than 2 to 3 days away from the human skin. Usually prolonged skin-to-skin contact, and is spread when surfaces are touched by the infection, a person infected with the scabies, and then it gets on the clothing, the towels, and others. We usually see it in nursing homes, prisons, anywhere there's close contact.
And this is reportable?
Outbreaks are reportable.
But just an isolated incident?
We don't ever usually have an isolated incident. So it's almost like...
Well, I guess I look in the home setting.
In the home setting, I wouldn't mind if somebody reported or called us, because we want to make sure they know how to protect themselves. We have scabies flyer on our website so they know, and we're going to talk. So symptoms are intense itching and pimple-like rash. It's an allergic reaction to the mite's proteins and feces in your skin. So head, face, palms involved. I mean, this shows a rash in humans and infants. So you have to use a scabicide to kill it. There's no other way. It's a doctor prescription, and everybody has to be treated. Whole household, sexual contacts, close contacts, anybody that could have close skin contact. And you should be treated, everybody at the same time. I can't treat one person today and one person tomorrow. Everybody's got to do it at the same time. And it needs to be, everybody take a shower and then treat yourself.
And I'm glad you told us that about the information on the website, because we do have a lot of referrals to go into the home. The patient already has scabies, and to educate and tell them how to treat and everying. So
yes, yeah, we need to make sure
that's a very
we protect
common thing for us.
Staff as well, because we don't want the staff to get it. So bedding, clothing, towels, toys, everything, 3 days before treatment should be cleaned and washed in hot water, drying in hot dryer, dry cleaning, or as you'll see, you can seal them in the bags for 72 hours. So I've gone quickly, and I wanted to take how long a break, and then I want to talk about our 2 outbreaks that we've had in foodborne
No longer
outbreak.
than a 10-minute.
Okay, we'll take 10 minutes, and then we'll come back and wrap up with 2 outbreaks that we've had.
Good. Okay. Thank you, Tina.
Thank you.
Gosh, Tina, that was a lot of information. And it was a lot of great, valuable information. I know you've got a lot more, so let's just go right on into it.
Okay, and I'm sorry for speeding us up, but there's just so much to share, and I want to make sure we get a lot of good information to you that you can use. So we're going to shift to outbreaks, and we're going to talk a little bit about foodborne, and then we're going to talk about 2 outbreaks that have occurred this year, one being foodborne and one actually in a clinical setting, not related to food. So foodborne outbreak, we're looking at 2 individuals who shared similar illnesses from the ingestion of a common food. So they're not in the same household, but they ate the same meal and they had the same symptoms. Exceptions are botulism and chemical poisoning. One case of those is an outbreak. So where do we see most of our foodborne outbreaks? Restaurants, church potluck suppers, fundraising events, reception of large gatherings, and caterer events, especially those that do not have to have permits to serve food. So a lot of these, churches that serve large meals aren't permitted by public health. So that's where we can see, because they're not aware of how to serve the food and cook for large groups. Holiday parties, and when people don't follow proper food preparation, storage, and temperature controls. That's just the point of it. So why does it happen? Improper holding temperatures, inadequate cooking, cross-contamination, and poor personal hygiene. So holding temperatures. Hot food should be kept at least 135 degrees, and cold food at least 41 degrees. If they're not kept at these, you will have a foodborne illness. Improper cook temperatures. So making sure, like I said earlier, have a thermometer and make sure you're cooking your food properly. And you're saying something about the appearance of food. On the hamburger patties, what do you see on the hamburger patties? What do they look like?
Well, they look like they're done.
They look like they're done because they're all blackened and everything.
Yeah.
These hamburgers are actually not at the right temperature. So this is from an environmentalist that went to do an on-site inspection and put the temperature in the meat. They were not temping their meat. They were really looking at as It's a look test. And so it shows that you can't judge the food by what it looks like. It may not be hot enough on the inside to the proper temperature to kill the bacteria that can cause illness. So the temperature chart I referred to, this is just a great resource for you to have personally, to share it if you in your church and others, to know the temperatures that your food should be cooked. Cross-contamination, so wash, rinse, sanitize. Don't use cutting boards with raw foods and then ready-to-eat foods. So meats and vegetables. Have separate cutting boards. Make sure. That's very important. You'll see the picture here that has the sink. There's a spoon in the sink. It's laid over. This is a sink where they wash their hands, but this is also the spoon that they use to serve food. So all the splatter that can happen. So poor hygiene, that's talking about exclusion of sick employees or any person preparing food when they're ill. Hand washing, making sure people wash their hands. And I know every restaurant you go in, there's signs. They have to have that signage. It's required for them to have signage about washing their hands. No bare hand contact with ready-to-eat food. So you'll see cutting the tomatoes. You shouldn't be then handling meats and then handling. You should not go to work or school when you have vomiting, diarrhea, yellowing of the eyes, sores with pus. We get calls a lot about people that work in restaurants having sores on their arms. And I mean, people, just to make common sense, if you have sores anywhere, I don't care what you do, you need to wear sleeves and first wash and keep that clean and dry and cover it. And then wear clothing that covers any type of sores on your arms. So they should be excluded if they have any kind of sores on their hands in preparing food. That will cause a huge staph, because the staph that's on your hands can get in food and cause a severe toxin effect. Fever, constant coughing, sore throat with fever. These are symptoms that you should go to your doctor. People shouldn't be serving food, taking care of patients. So again, how does cross-contamination occur? It's just organisms get into the food either by any of those mechanisms that's not followed. So it can cause from raw food to ready-to-eat food through equipment, food handlers, cooking utensils, or surfaces. So it could be refrigerator handles, knives, or preparation area. So those are some of the things to think about. And this shows a picture of someone washing chicken. You do not have to wash your chicken. I know it's always been done, but you put yourself at more risk by washing that chicken. And this shows, this was through CDC, washing the chicken, how that germ just spreads out. And I know that people say, well, I wipe everything down with Clorox. You will not get everything. There is no way. So if you take that chicken from the package it's in and you put it in whatever whether you're going to boil it, bake it, whatever, and you cook it to the right temperature, you will never get sick. You're not going to get sick because you don't wash chicken. You're going to get sick if you don't cook it at the right temperature. And so also making sure, looking at your hands, your bare hands, and then touching raw foods. Symptoms: fever, vomiting, diarrhea, nausea, chills, abdominal cramps, and again, people that are high risk, pregnant infants, people with a lot of medical conditions, older adults. Those are there's the highest risk to become ill from a foodborne. So how do you stop it? You've heard it and heard it and heard it. Wash your hands. Soap and water before and after going to the bathroom, changing diapers, handling or feeding animals, your pets. Wash all surfaces with hot soapy water before and after preparing each food item. Paper towels to clean up surfaces, or if you use cloths, make sure you wash them. Don't reuse them, so making sure that you wash those regularly. Rinse all fruits and vegetables, including those with skins and rinds, under running water. So and I know sometimes even the ones that you get in the bags that says already been washed, I'd wash them again. I mean, you can't protect yourself too much. And then making sure you rub firmly those fruits that sometimes, that you just have the hard surfaces to make sure that you clean them well. And then clean the lids of canned foods. You don't know what it's been exposed to. You don't want to have that canned food and then you pop it under the electric can opener and then it's in there. It's just, you don't want to put yourself at risk. And again, raw and ready to eat. Transport, storage, and preparation. Always understand, it's not just when you're cooking. Don't store the chicken above fresh produce. Don't put that in your refrigerator like that. Because that liquid, I mean, might not be sealed well, and then it leaks down on all the food. You've contaminated everything. So making sure how you store your food is very important as well. Best prevention, I don't know how many times we've said it today, hand washing saves lives. Hand gel does reduce the number of germs, but it does not eliminate everything. And it is a potential to misuse. So wet your hands first before you apply the soap under warm water. And then once you apply, you really want to firmly rub your hands together, rotating. Always remember the back side of your hands under your nails and between each area. I mean, just continue that for at least 20 seconds. They say hum the happy birthday song from beginning to end twice. And make sure you rinse your hands, get under the nails and everything, and then dry them well with a clean towel or air dry. So again, before, during, after preparing food, before eating, caring for someone that's sick, before and after treating a cut or wound, after using the toilet, after blowing your nose, coughing, or sneezing. After touching an animal or animal waste, after handling pet food or pet treats, and touching garbage. And I know somebody, you think this is just common sense, but sometimes people don't think when you're tying up the trash, I'm not touching the garbage, I'm just tying it up, that you're actually coming in contact with organisms. So we do have additional guidance, and I just wanted to put this here on the document library about infection control through APIC. These are precautions for, it has home health agency, home health has long-term care, it has hospital. This is just another resource if you'd like to have additional information. It is very valuable, great information. So, notable outbreaks for 2013. We'll talk about a funeral mill at Sumter County. We did have Legionella in a nursing home and rehabilitation center that actually had Legionella cases in the patients in the nursing home as well as their guests. MRSA infections after joint injections at an orthopedic facility. So we had people coming in for steroid injections that had a steroid with like lidocaine, and they developed severe infections in those joints. The joint is a sterile site, and you inject there was contamination in the preparation of the steroid injection, which caused severe infections. Most of the patients had to go to the operating room multiple times for debridement of the wound and are still getting treated. So your technique and how you, the things you do, you need to pay close attention to proper procedures. So we're going to talk about a notification of a healthcare facility in Jefferson County where we were notified by a physician for a full-service spa, fitness, wellness, rehabilitation, and diagnostic center. So I always say you could get your toes and your stress test done at the same facility. So they had what's called cardiolite stress test on 5/7 and 5/9. So there's 2 dates that we were looking at. All the individuals, there were 9, developed fever, severe chills, rigors, headache, nausea within 1 to 2 hours of the procedure. So cardiolite stress test determines if the coronary arteries are supplying the heart with enough blood. And it's injected through a vein in the arm, and it carries the tracer to the heart, to the coronary arteries. So the cardiolite is a nuclear medicine. It's radiologic medicine. So this is something that's prepared using very sterile technique. Once it's prepared, you'll notice on the slides that these are syringes that are pre-filled, done before they ever get to the facility. Each patient has their own syringe. It's not like there's 10 syringes and somebody just each patient has something with their name on it. And then the cardiolite, because it's radioactive, is put into a metal sleeve to protect it until it gets to the facility. So it's very, the procedure to prepare it is just meticulous. So ADPH and Cardinal Health was the preparer of the cardiolite, contacted all 12 healthcare facilities who received the same 6 lots. No other adverse events were reported. And we call that a clue. So when you got 12 healthcare facilities and nobody else is having problems, you got to go back to the first call. So we were working with the Board of Pharmacy. They actually visited Cardinal Health and went through their whole procedures about how the preparation of this. And the Office of Radiation Control also assessed the procedures producing the cardiolite. They regularly go out 2 o'clock in the morning and show up to these facilities to see how they're preparing. Unannounced, show up. Different times. It could be any time, so you never know. So our Office of Rad Control does a great job in making sure that there's safe procedures. So it was immediate response from us. Visit facility, look at how their procedures are being performed, interview the patients, interview the people involved. So an in-depth investigation, looking at medical records and assessing the notes recorded during the procedures. We interviewed 15 patients that had a stress test at this facility. Also had what we call a main campus. So we interviewed people that had the same week, the same procedure. So many patients from the main campus reported similar symptoms, but the individuals whose stress tests were performed at the outbreak site were 2.5 times more likely to report nausea following the procedure than patients having the same procedure at the main campus. So the frequency of the symptoms was not significant different between the group. What really we saw was a lack of sufficient documentation during the procedure, times and intervals between injections, comorbidity conditions. There was not blood pressures documented. There was not injection times documented. There were not even times of when the patient became symptomatic. So we couldn't even say, okay, they started the procedure and they were admitted here. Well, here's all these symptoms. It said 1 to 2 hours after procedure, but there were no symptoms documented. So the documentation was very poor. So this just shows the symptoms, and it just shows 100% had, nausea, headache. That was the most common, was the nausea. So 8 used and 1 unused cardiolite syringe were, from dates 5/7 and 5/9 were submitted to the CDC for testing. 2 of the unused saline syringes were submitted. Tests on all 8 of the used syringes revealed Pseudomonas. That's another clue.
Oh.
The unused syringes and saline showed no growth. This is what we see. We do fingerprinting. CSI has their testing, so does the state lab and CDC. So this is our CSI moment. This is when we all get chills and epi, when they all grow and they all match. So all the syringe matched the same organism, show they were all contaminated in the same way at the same site. Pseudomonas, opportunistic pathogen. It's usually found in soil, extremely wet conditions, and it could definitely explain some of the symptoms. So even though we'd done a lot of interviews, I called again to talk with the nurse involved that was helping me, and she told me that it was revealed that the nuclear pharmacy tech, after delivering the cardiolite dose, would reuse the cardiolite syringe and go and draw up sterile saline from a 10 ml syringe and then flush the line to make sure the cardiolite was delivered. The nuclear medicine tech then would follow up the sterile saline. He'd go back to the saline syringe and directly from the saline syringe inject that. So it was not protocol to do this, and it definitely shows the way that there could have been contamination because not proper procedure. So although the source of the contamination remains unclear, and proper practice and technique is likely how the contamination occurred. So Lots of
Wow.
partners. We work with, again, Office of Radiation Control, Board of Pharmacy, the healthcare facility, the pharmacy manufacturer, and CDC, as well as our other partners in public health. So when you're working an outbreak, it's not just epi, it's not just, there's so many people that are critical for us to get this done.
How long did, just one small, how long did this whole process take y'all?
I can't remember. I don't know, we get on it right away, and probably within like 24, 48 hours, we're starting to know what's going on. I mean, it's not something on these type situations. We think there's a possible contaminated product. It's one of the most severe situations because there has been contaminated product, so we get on it rapidly. But it takes time to interview patients and get that done, so probably a week, you know. And then send it to CDC, you know, getting specimens at CDC. It could come on for months before everything's resolved. So lessons learned, thorough documentation's a must. So for you, document. Oh, it's just, oh my goodness. All new employees should complete an orientation process, a proper procedure for patient care. This was not done in this case. And quality improvement procedures should be in place to identify improper employee practices. If any of this had been in place, this would not have occurred. So funeral meal outbreak. We had a church in a rural county. Following a funeral, it was around noon on July 6th, approximately 100 family and friends. We were notified Monday, July 8th, of a surge in gastrointestinal illness at emergency departments. We had fever, diarrhea, and vomiting. We had 25 patients presenting that had all attended a meal at a funeral. So, again, that's a clue. When we have 25 people surging in the ER, especially in a rural hospital, and they all say, we all ate this, they're all friends and they're all together, you quickly know we got a point source, what we call a point source outbreak. So we had attendees from 11 states.
Oh, me.
I hate to say the one good thing is the patients were so sick they weren't able to go home. They were hospitalized. 80 reported ill, with most of them in the hospital. We had 43 attendees interviewed. 38 were ill. It was so hard to find anyone that was not sick. We had one attendee, unfortunately, that died in his sleep. He was found Tuesday morning. Friends reported that he had complained of GI symptoms on Sunday. We did an autopsy with UAB, and he was positive for Salmonella. So clinical specimens were submitted to CDC for testing, as well as our state lab and environmental samples from the church, where we go to the church and we actually swab and look for possible contaminated areas. So age range, 4 to 75 years. Symptoms, incubation was 2 to 5 to 42 hours. Now, that's unusual to have such a wide incubation period. So anything 2 to 5, we're thinking toxin, something that, because anything that fast, your body is trying to rid itself of it.
Right.
So you'll have just profuse vomiting or diarrhea trying to get rid of it. 42 hours, you're thinking, that's got to be a bacterial, because it takes a while for it to grow and start causing symptoms. So this was unusual for us to have such a wide range. 100% diarrhea, abdominal pain, fever. Highest temp we had was 107. So people were severely ill and dehydrated. So public health county environmentalists visited the site. The meal was prepared on site by 3 individuals, included baked and fried chicken, potato salad, macaroni and cheese, green beans, and creamed corn. Had some pulled pork, potato salad, dressing, and beverages that were brought in as well. But the 3 cooks cooked the other food. When they got to the site to do the environmental assessment, the temperature was 46 degrees. If any of you were listening before, it should be at 41 degrees or less. The baked chicken was cooked on Friday, 176 pieces. It was baked, and then it was put in front of a window air conditioning unit to cool for 1 hour before it was stored in the fridge. The raw chicken was stored in the bottom of the fridge next to prepared macaroni and cheese. The cooked potatoes, we had cooked potatoes that were also drained in the same sink where the chicken was prepared. So our 23, we got 23 clinical specimens, all were Salmonella Heidelberg, and they were all DNA matched. So they all were the same infection, same organism. Blood and stool from the deceased individual, also Salmonella Heidelberg. We also found that Staph aureus, or staph enterotoxin, so a toxin was positive in one clinical specimen. So that shows us that sudden onset, that 2.5-hour incubation was likely the toxin, and then we had the bacterial. So we call this a superantigenic effect, where you had the toxin followed by the bacteria, and the people were just, that's what caused the severe dehydration. Everything else was negative. So 28 environmental samples some tested positive for Staph aureus and staph enterotoxin. And samples from the faucet handles, and stove handles were culture positive for what we call B. serous. Analysis, I'm going to tell you, just trying to save some time for any kind of questions you might have. Pretty much all the food was contaminated. There was some, like green beans were more likely to become ill, but it really was not significant. Lowest attack rate was of any food consumed was 90%. So that just shows depicted definitely a common point source, and it's unlikely that there was no statistically significant food item, that likely everything was contaminated. Contributing factors: mixture of cross-contamination, we had talked about, contaminated equipment and utensils, improper holding temperatures, and improper food storage. So all the 4 that I talked about, all 4 were of what happened. No use of gloves were reported while preparing the food.
And you wouldn't think you wouldn't think that 5 degrees would matter.
Right. But it does.
But it does.
5 degrees matters. And I think people do not understand, and I know they don't understand, the risk that, churches have always done meals.
Yes.
I was raised Baptist. I understand. We've had homecoming. We've had everything. You have food on the ground, and people are bringing in food, and it's out in that hot temperature. Or and now it seems more and more that people prepare for large meals. I don't know that we used to have kitchens that much that prepared at the church. But
right.
More and more we see they serve Wednesday night dinners or Sunday night dinners, or you see, I'd never heard of a funeral meal. That was something new to me. I didn't know that they would actually serve. But what people need to understand, when you're preparing for large groups, you have to understand those cross-contaminations, how those organisms can spread from, if you handle the raw meat and, cooking it at the right temperature, putting it in the refrigerator next to something that's ready to serve.
Right.
You wash the chicken, and then you're going to wash the potatoes. It's just things that, always cleaning surfaces. We were talking about cleaning surfaces between different food items. So our goal is to really get out there and with churches and these nonprofits, because we want them to understand, we know you don't want to be put at risk.
Right.
But these organizations were sued. Insurance had to pay out. You can be sued civilly.
Wow.
So let's say you prepare a meal for somebody and they somehow find you did something wrong. You can be sued civilly. So you don't want to lose your house and your retirement and everything else that you have. So you have to understand, in our litigious society, you got to be careful.
Well, that is just scary. I mean, we do
And I don't
a lot.
want to be scary. It's just the facts.
It is.
I mean, it is just understanding that you need to be careful with how you prepare food for large facilities. And we talked about the outbreak related to syringes, thinking about the joint infections. They were preparing over a sink, and it was a common Bivacaine was 100 mils, had a little spike on it. Well, they were all drawing up all day long. So people using sterile technique with in and out of that Bivacaine, the lidocaine, and then trying to draw up other syringes, and there was wet area all around the sink, and this was a high traffic area there because the people from the office were coming straight through and going into the patient area. And you shouldn't be preparing around any high traffic area as well. So there's just a lot of things you have to take in consideration. So when you're in the home, that's why we're talking about before you flush a port. There's procedures about sterile technique and about how things need to be laid out and using gloves and how things need to be drawn up and not using multi-dose files and other prevent scenarios like we're talking about today.
And again, it goes back to follow your policy and procedure, and document.
Documentation's key.
That's it.
Proper hand washing, proper procedures that are in place. We put procedures in place not because we like writing them, because I hate writing anything. And I don't want to be able to come up and tell about deaths and disease and these morbid type situations, but we need to understand the risk. And that's why it's about protecting yourself and others. So
now, I'm going to change that. We've only got just a few minutes left here, so I'm going to change back just a little bit to, reportable.
Okay.
So I know you showed us the forms and whatever, and with being that home health nurse, then I'm thinking during your whole presentation, okay, I have seen patients that have had diarrhea. They may have had a little nausea going on with this, and I would call the doctor, and it depends on if the patient can really get out to see them, or they may just call in some antibiotics or something like this. And so that patient may have had a lot more going on than I was aware of. And I'm for sure if the doctor didn't do any blood tests or stool cultures or something and didn't order them, whereas in home health, if it's not ordered, you don't do it. That patient could have a lot of stuff going on that we or I should have reported but didn't know to report.
Well, and I don't put the burden on you. You can only do what you're allowed to do. And that's why, again, the surveillance pyramid is upside down, because doctors don't test patients. If you were in that scenario, let's just say you're there, you have a patient that has diarrhea. If our community education needs to be with that doctor, that if you have patients in the home with diarrhea, we collect specimens all the time from patients at the home. Now, I don't know what your procedures are, so I'm just going to talk this through.
Okay.
If we had diarrhea, we have a sterile cup, and we get any of that stool in a cup, we could send to our state lab for testing. Doesn't cost the patient anything. We're trying to identify organisms that's reportable, and the doctor doesn't, it helps him diagnose his patient. Do you want to treat a patient with E. coli with an antibiotic? I mean, treating a patient with E. coli with an antibiotic could cause them to go into kidney failure and die. So it's not good just to, hey, throw them an antibiotic. We know with antibiotic-resistant organisms, that's not the answer. Right. But we want to treat that patient, so treating that patient's diagnosing that patient. So that's where we need to work with the providers in the community. We need specimens. And it's a population I've never thought about, never had this question asked to me and didn't realize the situation. So it's great learning experience for me to understand how maybe we can be a resource for your patients to try to get specimens. And maybe it's working with one doctor and learning one way to do it in one area and say, you know what, this is a good process, this is what we need to do, and this is helping these patients. This doctor can talk to his counterparts to say, I've noticed that a lot of these patients are just diagnosing with gastroenteritis actually had types of salmonella that we need to treat different, or we're causing more severe illness. That's the only way we find out. That's what public health's all about.
So I guess we just need to be a little bit more proactive here, and when
together.
we call the doctor, right, say, hey, can we get a stool specimen, and send it off, and we can just, once we get that order, we can send it right on to, the state lab.
And I know it can be difficult because I work with doctors and trying to easily suggest something. You don't want to overstep. You're not trying to tell them how to treat their patients. So I understand the balancing act. But we've got to find a way because the patients deserve that.
Exactly.
So it's a great, thanks for teaching me something today.
Oh, well, listen, I know it's the end of our program here. And Tina, this has been great. I could go on and talk with you about this for another hour or so.
Yeah, we'll spin that off air.
So, in closing, is there anything that you want to leave with the audience?
No, I think it's just understanding about, any way that you can protect yourself. And, of course, the number one thing is washing hands.
Exactly.
But also understanding the risks with food, when you're serving food to others, understanding the contamination issues, that's just critical. And I hope today that you learned some of that about how to protect yourself and others.
Well, thank you, Tina.
Thank you.